Welcome back to Voices of Long COVID. I'm your host, Noelle. This season, I'll be bringing you strategies and support for living with our condition and discussing current themes around the topic of long COVID. I hope you'll find the information useful. My guest today is MaryJo Nabuurs. She is co-host of the Resistors Audio Spaces, Officer of Media Relations and Outreach Spokesperson for Ontario School Safety, and volunteer with the Ontario Health Coalition. She is a vocal advocate for proper investment in public education, public health care, and long-term care. Welcome.
Thank you so much. It's such an honor to be here.
Thank you for your advocacy.
Yeah, well, no problem. And I wondered if I could just say something right up front, if you don't mind, because
Sure.
I've listened to your other podcasts and they're so wonderful. And the people who have shared their stories are some incredible people. But I want to be upfront that I'm not an expert in anything. Like many of you, just a concerned person, parent, until recently, a daughter of people in long-term care. Like you said, a supporter of funding and support for public, services and things, and who's just done my best to try to keep informed over these last many years. But I also wanted to say that I don't suffer long COVID. And so I want to thank you for having me on. I'm honored that I'm in a space like this. Because over the years, I've luckily connected with and spoken with and been part of, audio spaces with others sharing their long COVID journey and, other chronic illness sufferers. And so I just want to say to them and to their caregivers that as they look for ways to feel better and cope with their new reality maybe and advocate for a cure and for preventing more infections, that you're some of the bravest people I know. And I'm also uber aware that I'm easily an accident or one infection away from suffering the same, which is partly why, I fight for things like you do. So just a big thank you for having me on.
Well, thanks for being here. Can you explain why clean indoor air is important for schools?
So the role that clean indoor air can play in schools is multifaceted, actually. And, there's a lot to say about it. I would say, the COVID pandemic, we know, has shone a light on many things, one of which is how much transmission of illness out to our communities stem from school settings. A large study done several years ago about the spread of COVID-19 specifically in households, measured that 70% of household COVID infections stemmed from a child, 40% being from school settings. The people it gets brought out to from school settings, could be pregnant parents or caregivers, grandparents who live with the family, coaches and teammates when they go out to play their sports games, tutors and events at libraries, doctors' offices, babysitters, and the list is endless, really. So, and this is assuming that, no mitigation tools are being used in these places or by those people. So the impact is huge. We've also learned how many other viruses behave like COVID-19 and are spread the same way, either in full or in part. So for measles, for example, we know it can be fomite transmission, which is when you're touching the other person. But we also know it can linger in the air for up to 2 hours. So we're learning a lot more about a lot of other sicknesses that can be prevented. We also can see the increased conversation around absenteeism. I tend to not like to use that term. I tend to use absences because so often absenteeism seems to give a feeling that it's like a laziness on people's part, why they're not there. But I know, for technical purposes, that's how they report it under that term. But when it's spoken about more often, we know that it seems like that's going to be a priority for some schools and school boards, and not the priority of making it so people can be present, right? So, if you want absence or presence of students and staff, then why not invest in ways to improve their ability to be present, right? It helps with equity and mental health, with productivity and stable schooling, etc. We also know that now there are abundance of links shown to overall better health, both physically and mentally, when breathing in and existing in optimum air, versus polluted cigarette smoke filled air or even extreme heat. Very few people would support putting smoking back into indoor spaces, especially where our kids are, or opening windows widely when there's wildfire smoke, around that building. So tied to this point is that we see no sign really of decreasing these extremely high temperatures we've been seeing or wildfires. The air we exist in matters more than ever before because of that. We'll be forced inside more than the 90%, I think, average time data show we spend indoors already. This will impact us in a few ways. Although we may be protected from outdoor elements at that point, we will be more exposed to things like indoor air quality issues like infectious diseases and the others we know travel the same way and get breathed in by your desk mates or fellow educators. And also things like volatile organic compounds, extreme heat, as so few schools have adequate, if any, air conditioning, microplastics, and other allergens and asthmatic triggers. And I guess the last point I'll make, and I know it was a long answer, was the need to improve indoor air quality in schools and school buses is not new. We've seen reports in Ontario, where I'm from the 1990s, where it was brought up. It just never got the attention it needed. And the ongoing COVID pandemic, the fact that we're shown to be in a time in history where pandemics will be occurring more frequently, and with the climate crisis as it is at the moment, we can't wait any longer.
Mm-hmm. Yeah, I think we're well past time to make clean air a priority. And I mean, we don't question that clean drinking water is essential.
Right.
And we would never send our kids to school to drink contaminated water. So,
Yes.
yeah, I think we need to address this. What does the science tell us about how COVID spreads indoors and why isn't hand sanitizer enough?
The science is clear despite it feeling like it isn't, but the science is clear. It's taken a painstakingly long time for some of our typical leaders in public health to admit it. And sadly, some still haven't. But COVID does spread through the air, and it spreads both indoors and outdoors via aerosols. So when we speak, sing, laugh, cough, yell, the virus attaches itself to the aerosols we breathe out and then float in the air. Initially it was suggested that COVID-19 was spread via droplets, which typically, come out the same way but fall to the ground shortly after being exhaled. We can remember the 6-foot rule, that was first in place. But again, the science is clearer now that aerosols float for greater distances and linger in the air for longer periods than do droplets, making empty rooms and places like elevators surprising areas of potential risk. So a space empty of humans doesn't necessarily mean it's empty of viruses. It could be free of viruses if it has been empty for many hours and or has like great ventilation and filtration tools, but you can't be sure unless it's measured, of course. So I did mention it can be spread outdoors just because although it's lower, and that's great, I don't want to neglect to mention that it is still possible, right? So it's definitely lower risk, but it can. So regarding the hand sanitizer piece, so firstly, washing hands is a great thing to do in general. I am not against washing hands. However, the regularity of public health messaging that continues to this day in many places, unfortunately, that lists hand washing or using sanitizer as the first line of defense against an airborne virus, I would say is akin to sending a group of kids into a classroom where adults just minutes before had filled it with smoke from cigarettes they had been smoking, and then telling the kids to go in and say, but clean your hands and you'll be fine. It's nonsensical.
Mm-hmm. That's a good visual.
Yeah, exactly. And you need to clean the air. And I think most educators in that scenario would automatically choose to keep the kids out of the classroom until they opened windows to clear out the smoke, right? So why wouldn't public health guidance suggest cleaning the air first? It just doesn't make sense.
Mm-hmm. I've seen this firsthand when I worked in elementary schools, but how does poor air quality in classrooms contribute not just to COVID, but to other illnesses and absenteeism and learning outcomes?
The one term that I have found myself using, like from early on, the ripple effects of COVID. And now we're talking about not just ripple effects of COVID, but of air quality in relation to COVID and other illnesses, like you mentioned. So the ripple effects I'm going to speak about are of not ensuring the best air quality in the places in which our kids and all who work in school settings spend the most time. There's going to be more frequent illness, more chronic illness, which can lead to food and housing insecurity, increased bereavement because of death in a household related to illnesses or issues connected to poor air quality, issues that could have possibly been prevented. And, I like to note that bereavement is the number one cause of poor academic performance. There will be more workplace absences everywhere, not just in the school system. You'll have parents and caregivers who need to stay home with a sick child or because they are sick themselves, and teens who work part-time, most often out of necessity, could be missing their shifts. This means impacts to the economy, to our healthcare system, which will be more heavily burdened due to need when children and teens are sick frequently, or even just feel drowsy because the air is so poorly ventilated that they feel groggy, or if it's just so hot they can't think. It seems logical that learning will be negatively impacted in that case. And if I can just expand on more frequent illness for a moment, I'm speaking anecdotally mostly, though there is definitely more data being analyzed which supports this as time goes on. My kids are older now. They're 15, 18, and 20. But I remember when they were little, and I assumed because they went to school, they were going to get sick all the time. I wish that I had understood back then that we didn't actually have to accept frequent illness in them just because they attended daycare or school, that it has been the buildings that were sick more so, not them. But what we are seeing now is how many young families have come to think that it's normal for kids to be sick 10, 12 times a school year, sometimes missing 20 or more school days before the end of the year or sooner. That is not normal, even by my standards, when I expected my kids to be sick. This frequency is not how it's always been. And even when our kids got sick, which we thought was too often, it was not as frequent as it appears to be for many now. And I think young families need to hear that.
Yeah, it seems every time there's a new wave of COVID, the number of students, teachers, teachers' assistants, administrators who miss work and school due to COVID, it's extremely disruptive.
Yeah,
And this push to no longer test and then return to work after 24 hours is really concerning.
it is concerning. And
It's
when
not
the classroom is not stable, neither can the learning be, right?
absolutely,
Yeah.
yeah, so much instructional time is missed. And this, return to work after 24 hours, it's not based in science. And
Well, you
people
can't
are,
possibly feel well going back to work in 24
no.
hours, especially if it's like a COVID type of illness, right?
Yeah, we know that people are contagious for much, much longer than that.
Yeah.
What are the key measures that schools can take to improve indoor air quality?
I'm going to speak of in an ideal world, what they could do um, to set clean air policy. That would be great if a school board could set that for their board, measure the clean air using the various monitors available, enforce the policies, and revisit them from time to time with if there's any more science out there that can back things or new tools to implement. Um, there's CO2, carbon dioxide monitors that you can get that helps sort of act as an indicator of how much rebreathed air there is in a space. There are PM 2.5 and PM 10 monitors that measure things like particles of a certain size, things like from smoking or cooking, from gas stoves, cleaning products, and outside sources even. The PM10 specifically is more for dust and pollen and mold spores. You can monitor humidity and temperature. And all of these are air quality pieces, right? They can do things like, assuming that the air outside is reasonable, do more events and activities outside than in, if you can do that. Access and use air purifiers wherever and whenever possible. We have heard disappointing stories about schools that don't even have them in the buildings anymore, let alone in a room with covered in dust or with another tabletop as an extra shelf. But the idea is that you need to check the brand you're using, what to ensure they have, don't have. And then there's also a lot of do-it-yourself air purifier options, right? Which is a great activity for students. Life skills, volunteer hours, eco and spirit clubs, because you can decorate them. Lots of opportunity there to have fun and to get the engagement from kids in it. Increase ventilation by opening windows if they open and if the air outside is okay. Educate a volunteer or two to check that when the school has indoor events, that they maybe have the best air quality that they can get by saying, oh, does this space have some doors that can open? Can we get the air purifiers from a few classrooms down in there? Or can we do them in smaller groups over a couple of days? And help your attendees stay awake and alert because we know the drowsiness that can come from those high CO2 levels. Hold information sessions for families. I have been part of a couple of my kids' parent councils over the last many years as the only masker in those meetings. Whenever there's an opportunity, if they're talking about inclusion or they're talking about mental health or whatever, I'll go, yeah, you know what else helps? And off I go on the air quality thing. And people have been at least receptive and respectful of when I share that information. But I find that really helpful because then you chip away at any walls they might put up initially, if there are any. If you just kind of keep mentioning it over time and you show, you maybe have a few examples, or you bring in a monitor and they can see it, it's a little more interesting. So, if you can get something like that going, a relationship built, then you're more apt to be able to say, hey, I'm happy to host a do-it-yourself air purifier session, or get help to do one, or, send an information sheet home and say, hey, look what you can do in your homes if you want to help, stay healthy if one of you, catches something. Any kind of little tidbits of information you could share over time can end up building up to, a few people making these changes. And I think nowadays that's really how we have to kind of approach things, right? It's from the ground up to make the
Mm-hmm.
changes.
I love what you say about involving students. Like we could have a clean air club in
Yeah.
every school, and I'm sure kids would love to take that on. And, as a teacher, you could have your students build those Corsi Rosenthal boxes as a
Hmm.
project, right? Have an inquiry project. There's so many ways to involve students in
You
that.
can. Yeah, it's amazing. They have
And
like, oh, sorry, go ahead.
I was just going to say some of these things are out of our control in terms of cost for the district, but some of these
Yes.
are low to no cost, right?
Right. Yeah.
And when I was teaching, there was a lot of whispering of some districts telling teachers not to bring in air purifiers.
Mm.
And I just brought in my own. No one was the wiser.
Yeah.
And the noise level in a classroom is usually so loud you couldn't hear it anyways, right? So
Yeah.
there's no reason you couldn't do that as a teacher. Yeah.
There are definitely those obstacles I know of. And that's part of the equity issue, right? That one, let's say, principal is open to it. They happen to see it. They're like, fine, even when it's too hot, you're allowed to bring in a fan. And others don't. And so you're like, well, why are my kids and my, or me as a teacher subjected to this poor air quality when down the road they have access to all the things, right? Even within a school, if one teacher like yourself has the knowledge and has the air purifier on, but other teachers don't, it's not to take away from yours. We shouldn't be saying, well, you don't get your air purifier anymore. It's, oh, you're like the best case scenario here. Let's make it, if they want to be equitable, then they're going to improve the other ones, not, reduce the benefits of yours kind of thing. So, and like you said, opening windows or whatever, whenever you can is helpful too.
But yeah, getting into equity, some classrooms don't even have windows.
Yeah, I know, right? Yeah. Yeah. If you're lucky to even have a window or a window that opens, a
Yes.
lot of them are just old and they've been painted shut a long time ago, right? And they're
Yeah.
so close, but so far, right? Yeah.
Um, how are marginalized communities more affected by poor indoor air quality? Talking about equity.
They are definitely more impacted. There's lots of data on that for sure. I would say that there are often multi-generational households in marginalized communities. So there are more people in the same space, often
Mm-hmm.
less room and less chance to isolate when someone is sick. There can be language barriers to education, to public health information. There can be challenges staying home when sick or to stay home with a sick child. They are more likely, because they are more likely to be working on hourly wages and likely have no or little sick day policy that helps them. They may have less access to outdoor spaces to take advantage of, or they could live more closely to high pollution areas in general. They also often live in older buildings that are less kept up or attend schools that are older and in more disrepair, and so are likely without adequate ventilation and filtration that we often talk about when it comes to air quality. As well, it's common that many aren't comfortable advocating for themselves in healthcare due to poor prior experiences based on their race, their gender, their socioeconomic status, any of those sort of typical factors that often impact the kind of treatment you might receive. So there are certainly many reasons why this is the case, where there are major equity issues for the marginalized communities. But it's also connected to the amount of funding that is getting to schools. I know in Ontario, and I know it's across many places in our country, there are cuts to public education happening at a time when there needs to be more funding going into it. Mm-hmm. And I know that where we are, school boards and educators themselves have so many things that they need that funding for. It's really hard for them to picture the air piece as the place they should put it. Some of them are just looking for paper, right? Like some of them are just looking for their day-to-day survival things that they need to teach these kids. So I can understand why this isn't top of mind. I mean, those of us who are involved know all the ways it impacts and all the things it could help improve if it was. I think that's why we fight. I'm also, like with Ontario School Safety, we're fighting really hard to help educators know that there's low-hanging fruit, right? Like these odd tools that we talked about doing. If you can at least get a CO2 monitor, and when it gets really high and the monitor itself is a red warning zone, maybe you also will see that, the kids are getting a little antsy, maybe a good time just to step outside for a minute and shake off some, energy, and let's get back in and clear that air out. Maybe you're pairing up with other teachers to kind of, decide how to handle activities. It's so much. I respect educators so much, and you would know this, you've got so much on your plate. And nowadays I find them even more overwhelmed because we hear of all the other issues with more aggressive behaviors in schools, and more sickness. So it's a lot going on. So anyway, I sort of digressed a bit there, but it's because it's not just about certain schools, but it's about the reason why schools in general aren't getting what they need.
Yeah, and I'm hearing a lot of opportunity for projects, right? Projects in the classroom. You can borrow aeronets from libraries and, have a competition with another class and see how low you can get that monitor to go. It's very effective, even just opening windows. It brings down the CO2 levels drastically. We're going to take a break and remind you that any discussion of modalities or treatments are not to be considered medical advice. If you believe you have long COVID, know that you are not alone. Seek out the many Facebook groups for community support, the Canadian COVID Society website for more info, and please speak to your doctor for medical support. How can schools be made more accessible and inclusive?
I would say probably two major things. By having the governing bodies, whoever they might be, for how your school districts and boards operate, update air quality standards. So if they follow ASHRAE, the organization in North America that typically sets standards for air quality indoors, they have an updated standard. It's ASHRAE 241. And it goes beyond standards for just sort of comfort, right? But also for reducing illness. It's really a great standard to follow. So if you can have these governing bodies adopt these standards and then have these standards enforced by qualified people, I think that would be absolutely more accessible and inclusive. I mean, remember, children are by law expected to be in school. Mm-hmm. So then by law, the people who are supposed to make these places safe, which almost every school board has as their mission statement, the word safe has to include their physical and mental health. And that includes, now we know, air quality, because it's got such a massive impact on all of that, right? And making them safe. And I would say, secondly, by finally including the discussion of air quality in all of their inclusivity days and in their self-promotion of inclusion, because I think at this point, speaking about inclusion without speaking about air quality and how you make it rooms and spaces accessible to those who can be harmed by poor air quality, which is really everybody now, it's just lip service then to me. It's up to those of us with the time and energy to keep plugging away at this to do so and to educate where we can so we can let the people who know who are truly trying to do good things by being inclusive in the ways that they were prior to 2020 realize that now after 2020 there's another way you can make that better and be more inclusive, and it's not doesn't have to be really hard, you know, the tools exist.
Yeah, and I would like that inclusivity to include mask wear. So,
Yes.
if like my daughter is the only student in a 600 student building wearing a mask, right? And it would be nice. She's going on to high school this year. I don't know if she's going to continue because she's going
Mm,
to be in a building with 2,400 people.
yeah.
Um, but it would be nice that she could feel accepted and included if she chooses to wear a mask. And then if someone sees her wear a mask and they go, oh, yeah, I feel comfortable doing that as well.
Yeah, you know what? Kudos to your daughter. My kids were really good too, and they're older now, so same thing. They've made some different decisions over time that I completely understand. If I was a teen, I get it.
Yeah, yeah,
So it's not easy.
no.
And I have to say, and I maybe should have said this up front, when I talk about ventilation and filtration, to me, filtration, I'm talking about masks because masks are just a filter for the face. They're the closest thing to the source of the problem. So they're actually the best thing, right? To stop it before it gets anywhere where you need some other fan-like thing to suck it in as it bypasses others before it gets cleaned, right? So we know now I would love it even more so if our federal government would loosen the parameters or update their policies on, the far UVC kind of things, right? Because we know that that also can rid the spaces of pathogens, hoping to make masking perhaps someday less required,
Mm-hmm.
right? So that that's not even an issue. So I often say to people who, many of them now, who don't want to mask, so it's not too late to start again.
Absolutely.
It's okay to say, you know what, I've learned more. It's not easy. Like it's tiring for those of us who do it all the time, right?
Mm-hmm.
To explain it all the time. And it's tiring, I find, I would say it's less tiring for someone like me who typically is an extrovert. So when I have my mask on and I'm grocery shopping, I look at people in the eye and I smile, or I'll talk to people, like public talk, my husband says, like to show sort of a confidence in myself that I'm okay wearing this and I'm normal and I'm a happy person. I'm not a doomer because I have this mask on. I'm actually a hopeful, positive person saying, look what I can do because I have this mask on, right? So, but I know for those who are more introverted, they just want to kind of get in and go and get out, right? Not have that. So, it takes a lot. And so I can only imagine for the kids what it takes to keep it going.
Mm-hmm.
Um, but I think when we show that masking is something that you can restart just because you stopped, that you can defend it, and there's going to be people who maybe won't ever be convinced that they make sense, but you've got to just find how not to spend your time on them. And hopefully you can find a way to arm yourself with some responses that are professional, brief, so you're not really spending your life explaining the wise decisions you're making, but maybe using that as an opportunity, right, to share how it might help someone else, or at the school say, oh my gosh, the kids in my class, so much coughing, and I've got to go to a wedding this weekend, and I'm making sure I've got this. I don't want, right? So
Yeah, I've
yeah,
got a
it's
lot of
definitely part of the conversation.
I've got a lot of answers. I never get asked. I
Good.
find people either look away or maybe
Yeah.
they kind of roll their eyes or.
Mm.
But yeah, I would love to educate, but
You'd probably like, ask me. I dare you.
ask
Ask
me.
me.
Yeah, ask me why I'm wearing this
Bring
mask,
it. Yeah.
please.
I have all these one-liners I haven't been able to use. Yeah. How disappointing.
Are there any standout schools or districts that are already doing a good job of clean air?
For a while now, my understanding is that schools in the Boston area have had good air quality monitoring things. I haven't seen anything. I haven't actively looked for it, but I haven't seen anything lately, discussing it or whatever. But I feel like they were early in doing that kind of thing, and I think it's something that has continued. I know that there are school areas in some countries in the Baltics who have had have taken on the air quality piece and have had good results. I know we have individuals that say, like we know Ryan Tennant, who's part of Ontario School Safety. He's an engineering PhD student at the University of Waterloo in Ontario. He's doing great things at the university. He's educating on the role of clean air, really getting a lot of people on board and hosting the do-it-yourself air purifier workshops. We know a young man, Shivan Taneja, now for many years, who's spent lots of years working, doing workshops around North America, has really gotten attention from Richard Corsi, and Jim Rosenthal about what he's doing, and he has YouTube videos about how to make the do-it-yourself air purifiers. Our own organization, Ontario School Safety, has created an air quality investigation guide to help educators or families to investigate what kind of ventilation systems they have in their schools.
Mm.
Because for most families, you mention these things, and I'm like, okay, I don't even know where to start. I don't know what that
Yeah.
is and what it's supposed to be, right? And even I, reading the guide, it's excellent, but I'm glad I have it because I go, here, take this, here, follow this and answer my question. We know, I don't know if you've heard of Ruth Booker. She's from Bristol in the UK. She has recently created an organization called Clean Air for Kids to bring better air quality to the kids of Bristol and beyond. There's Safer Air Project in Australia. They're having an event in September, by the way, and it's an organization dedicated to creating healthier and more inclusive indoor spaces for all. They've got a lot of great speakers coming in September. We have a local teacher, Andrew Dobby, in the area here, who's a long COVID sufferer himself, but he's a science teacher. And I've been to his classroom to visit it, and it's spectacular. He has a specialized classroom of science passionate kids, and every desk grouping has a DIY air purifier on it
Oh,
of
that's
whatever
awesome.
shape or whatever they determine. They have a whole system that they test air quality things. It's amazing the activity that goes on there, and that's just part of their day and part of their learning, but they just live amongst it, which is really wonderful. Um, yeah, so I think also with the advocacy that I do, I'm really linked with a lot of groups now. There are more groups promoting better indoor air quality in all sorts of spaces, but for sure in schools around the world than people who are oblivious to this topic realize. We are not one-offs. We are of many and many incredibly intelligent and experienced and educated experts who know that this is the path forward. So we are not alone. And it's important with the presentation that Ontario School Safety is putting together that it'll be like a video that people can share with their parent councils or their schools. Um, we'll be sharing a little section there about the history of this kind of thing, that it's not a new concept to open windows or ventilate your spaces, right? Florence Nightingale did it in the hospital when she knew she didn't want this sickness to get around. Like it's been around forever, but what we're learning through science and medicine is, there are different time periods, and there's different, like droplet dogma has been around for a while, and it's really hard for people to let go of the droplet thing. But now we're back to the aerosol thing. And so there's a real history of talking about air quality indoors. So it's not new. We have more science to back it. We have all sorts of examples of why we need to focus on it now, invest in it now, and lots of reasons how it can improve so many parts of our lives, especially for our kids and the next generations.
One of the most effective things I've seen in getting messages to kids is, schools have presenters come in
Mhm.
and, have assemblies or even into individual classrooms and talk about different social issues. It would be nice to have COVID included in this and,
Mm,
just refresh everyone's memory that clean air should be a priority and masks are an option and, educate kids and
yeah.
kids. I think it's really empowering for kids to have that information and make their own decisions.
I think that's a really important point. And I remember, um, so I'm probably aging myself, but I remember when it became, illegal to smoke indoors, like in restaurants and things, right?
Mm-hmm.
And I remember learning in school about the harms of smoking. Well, my dad smoked in our station wagon with the windows up all when I was a kid. Like we were driving in that puff of smoke we were referring to earlier, or people who came to our house, would smoke around Thanksgiving, that kind of thing. And I remember I was the one to teach my parents that actually was really bad. And it took a while to convince them all. And eventually my mom put some sticker on our door before people came in and said like, no puffin. It was like this little puffin sticker. And it really was no puffin, like do it outside if you're going to do it. And that changed, right? But it is often the kids because they're more learning the most current stuff,
Mm-hmm.
right? If we allow them to access it. And they have probably really, they can really, like you said, glom onto some things and then find that as their little passion, right? And end up impacting positively, the health of their loved ones without even knowing it.
Yeah, and I remember being 8 years old and in an assembly, and I'm aging myself or dating myself now, but back when cars, it was optional if you wore a seatbelt. And we
Yes,
had a
that's exactly it.
presentation. There was a presentation with the crash test dummy, and
Mm,
it was so visual for me. I've worn my seatbelt every day since then
yeah,
because they showed the impact of the dummy in a car crash with and without the seatbelt, and it
it is
just
violent. It's like
yeah,
really much greater than you would think at a very low speed.
yeah.
I
And it
remember
just
this.
clicked for me. And it was never a question from
Yeah,
that day forward that I wore my seatbelt. And I would remind my mom, who still thinks seatbelts are optional,
that
uh,
was so funny.
to wear,
Yeah.
seatbelts. So yeah, I think it's important to, being an educator. My heart is with educating people. Yeah.
Yeah. And I think it's one of the things that you wanted to talk about today was, how we're handling things as a result of COVID, similar to things in the past. And it's exactly those things like cigarette smoking, seatbelt wearing. We've it tends to go through the phases of, people going, what? Oh, you just want to bubble wrap yourselves, or everybody's in fear, or whatever. Like it's fairly normal. And it's because it's change and people don't really like change. And
Yeah.
unless you've got good, social psychologists on board with your communications and things, right? It could take a bit to convince people, but then the data shows. And then if things are mandated because it's a public health safety thing, um, then eventually there's compliance for the most part. We know some people, like your mom, doesn't always do it. But right, for the most part, we know most people seatbelt without even thinking about it. I mean, cars are made to yell at you when you don't,
Mm-hmm.
right? So it's become just the norm. And same with smoking. Like you're usually not, like if someone lights up, and my doctor used to smoke at my appointments. Like he had an ashtray at his desk, right? So if a doctor did that now, I mean, you would just laugh because you've got to assume that he's joking, right? Or she's joking.
Yeah.
Anyway, so those things happen. I think this feels different to me. The Well, first of all, the acknowledgement that COVID is a thing that matters to pay attention to and to not get. That COVID is still here, and that air is the thing you can't see.
Yeah. It's the invisibility.
It's the invisibility, right? And all of those things, the fact that air issues often can be invisible unless it's kind of smoke. The fact that COVID, we often call it stealthy because it doesn't show up like measles or make someone look really hideous. It doesn't necessarily show up the same in everybody. So even if you said to someone, oh, I had COVID and this and this and this, when someone else gets it, they don't get that. It's easy to assume you don't have it, even if you were even remotely thinking you could get it. The testing isn't there. And even if there are tests, there are some people who do test, and I'm so impressed by them, but they don't have current tests. They don't understand the most effective way to test, how to interpret those test results, and that they're not perfect. You've got pandemic, this virus that impacted the entire globe, and intensely enough that we know the death and the horror, especially initially, because there's so much so fast. And there's a lot of trauma around the globe over it. And then it happens to coincide with a real shift globally away from democracies and away from the public good, everybody being community and less about the self and more. So many things, I think. Capitalism, is so important. Getting people back to work seemed to drive everything instead of letting the science drive it. There's so many reasons that makes this one, if you're going to speak about COVID specifically, really a challenge. So what I've learned over these years of trying to educate people, whether it's in my personal life or just my community or in schools or online or through our audio spaces, I don't run from the conversation about COVID. I will talk about it, but it will rarely be my lead in if I don't know for sure that person or that group is open to it, because we've seen people's, the wall goes up, the eyes gloss
Yep,
over.
absolutely.
So it's really approaching it like you've been talking about a lot, just that it's air quality. Look at all the things we've learned from the pandemic and continue to learn, blah, blah, blah. But it also does this and this. And we've learned about how acute illness is now and their impacts down the road. I mean, we are learning spectacular things. I would never, ever want this pandemic to have happened. But if there's a silver lining, and it's small relative to the not silver linings that we've seen. But if there is one, it would be to say how much more focus is now being given to chronic illnesses, ways that these acute illnesses that we think are just normal to get can impact us later. Like there's so much more work being done because of the virus. We know people with ME/CFS or Lyme, chronic Lyme, who've been just begging for decades for help.
Mm-hmm.
And just haven't received it. But I think because long COVID has been in such a concentrated time period, and now with social media, everything, so much more attention given to it. It was a global thing all at once, or has been ongoing all at once kind of thing, that I'm grateful that more attention is being paid to all of those things, because I think that will help us down the road.
Yeah, that's got to be the silver lining, because my pet peeve is not learning from the past, not learning from our mistakes. What was the point of all this? What was the point of all this trauma if we're just going to continue
Ignore it.
to put on blinders? And
Yeah.
I don't need to change my behavior. I don't need
Yeah.
to make any changes.
Yeah.
Then what was the point of all that loss and all that trauma and all of that disability?
And all of that coming still, right?
And it's ongoing.
Yeah.
Yeah.
And I think that is why this is going to sound really condescending. I don't quite mean it that way, but well, it's probably just going to come across that way no matter what. But when dealing with people, I've gone from very angry about it all. Like I certainly have my moments where I'm like, oh my God, it's so obvious. Why aren't you doing it? All that. But when I'm more rational, my more rational frame of mind, and I'm about to maybe try to convince people that I think might have an impact, but maybe are really kind of oblivious, I try to come from the fact that, okay, there are different segments of people, right? But people who are just oblivious. They just have never paid attention to it. There's so many things in the world we could each be passionate about and involved in and learn about. We just can't do it all. So you've got people who work really hard to fight cancer and do fundraisers. They're just not going to do everything. And you can't blame a human that this is the thing we've, hooked on to is the thing. So I try to go, okay, they just don't know. I see them doing other wonderful things for their fellow community members. They're good people who just don't know, right? There's that. And then you have people who know, but are doing the, well, I only live once and I'm not going to live my life in fear or whatever. And I think some of that is a bit just misguided. Maybe they don't have all the info on how it's not necessarily living in fear. We're actually showing all the hope when you use these tools and do these things for everyone to live their best life, right? Whatever. Then you have the people, of course, who know and maybe are just more selfish and maybe don't care about others. And they're like, whatever, good luck to you. And you got to find those are the ones you're really not going to get anywhere with, and find where you're going to place your energy. And then I try to go in kind of feeling sorry for the people that I'm speaking to, that you haven't known all this time. And I can't imagine how many people in your life have been negatively affected and you might not even realize it yet. And that's really crappy, that the people we normally should be able to depend on for guiding us through such a massive public health threat have let us down, for the most part, profusely.
Yep.
It's just not their fault, you know?
You kind of touched on this already, but are there any parallels to past public health improvements like removing lead paint or asbestos?
Yeah, so I would think again, there's probably just the stages that people go through when they put up that fight at first, because it's going to require change for those, even with the air quality thing or COVID in general. But air quality, often people go, you just want to bubble wrap your kids. I got sick. Everybody needs to get a little sick sometimes, or playing in the dirt is good for you, right? And there's the whole, well, playing in the dirt is different than breathing in an infectious disease. Like they're not the same, but that's, a mindset that often our parents, or maybe even we, still had for a while there. So there's that typical kind of pushback. Then, there's that, it's almost like a grieving process, I'm sure, for some people, that they go, oh, fine, I have to wear these now because I just don't want to get hit by the police officer catching me not wearing my seatbelt, right? Or drinking and driving, right?
Mm-hmm.
So people kind of go, okay, fine, if they're hit by things. I think, as I mentioned earlier, that I feel like the thing about, improvements to air quality, because it's related to this really complicated pandemic that's been going on, I think the pushback here would be they're afraid of liability if they admit that, yes, we should improve the air in places because the data is showing. Because there are a lot of people go, yeah, well, we told you that 4 years ago and you didn't do it then. There's a lot of fear of that. But I think that's what's going to make the change. So although it's similar in some respects to these other issues, we've seen big changes in the past, you know, pushback and then finally complying because they kind of have to. I guess we're getting the pushback, the compliance, getting leaders to actually implement things that are useful is taking a bit longer. It's a bit harder. We're also in a world right now that feels like there's a lot of things to be concerned about. Like, how many priorities do we need to have? Wars, the climate crisis, like all things feel almost like they're all priority items, right? So it's hard to balance. And again, investing in something that you can't see seems to be a real tough thing for people to just absorb.
We'll be back to our interview after a short break. This podcast is dedicated to all the long COVID sufferers out there. I hope you find a sense of community by hearing these episodes and maybe find some tips on how to make living with this illness just a little bit easier. What are the potential long-term impacts on learning, development, and teacher retention if we don't address airborne transmission?
So the recent statistics as far as, long COVID, let's say chronic illness from COVID alone, is that there's about 450 million cases globally, though it is believed to be a huge undercount for a variety of reasons. There are so many symptoms of long COVID that it's hard to tell who has it. Many people don't even know it's a thing, so they don't know. They pass it off as so many other things. The medical community, not all are informed on it or think to even consider COVID as an issue. So we know that that's a big undercount. So if 400 million people sounds like a lot, just know it's way higher than that. And as COVID continues to spread, especially, it's weakening immune systems. And the studies are clearer on that now as well. So as it goes on and on, it's going to increase the incidence of long COVID with each infection. So we can't afford not to push a clean air agenda as one of the major ways to help improve our lives in the so many areas. We also know that COVID itself can impact behavior and judgment because of the area of the brain that it impacts, much like a concussion can. And people understand that to be true as well. And it may be playing some part in the increase in aggressiveness in students in schools or just in people in general, driving on the roads, was it car rage kind of thing. If we leave things as they are, I believe that our kids and education staff will suffer ongoing. And this means the next generation or more of people may have greater struggles than the previous generation, impacting society, I think, in ways that I'm not sure we've fully grasped. For sure, people who are not aware that it's still going have no idea. And it's not what most of us would want for those that are following us, for our kids and our grandkids, right? There was a very recent paper out of Vancouver, I don't know if you saw it, where they said since the start of the pandemic, overall 3,115 staff reported new onset chronic symptoms. This week, the Toronto District School Board, which is the largest school board across the country, its records show unqualified emergency replacements has jumped more than 1,100% since the pandemic started. So when you have staff that isn't trained and is what kind of quality of education are you getting there, right? And how does that impact students? Well, they feel less competent because they're not learning what they need from year to year. Any kind of flux ongoing is really harmful, we know, to education outcomes. And there's a recent JAMA psychiatric paper, explaining that getting seriously ill increases chances of depression, PTSD, eating disorders, self-harm. So for both students and educators who are, as we know from the data, are highly exposed to illness in the places that they work, similar to healthcare workers. What we know in terms of equity is in both education and healthcare, women are the primary employees in those industries. Women are also more apt to suffer long COVID because of our tendency to suffer autoimmune diseases more than men. So it is a gender issue, an equity issue. To me, in a lot of ways, we are now at the purposeful negligence piece by those who should know better and reasonably do know better, especially when we see examples of them protecting themselves in the places that they work in. And I would argue too that our students, being that again, we talked about earlier, it's the law for them to attend school. I understand you can homeschool as well, but in general, they're required to have an education, and the majority of families do send them in person. That is a child's place of work. That is their job as a child between, grade 1 and grade whatever year, what is it, you're 16, you're allowed to leave school, I guess, is that the legal thing? For those years, you are expected to be there doing your student job, your child job. So the data is now coming out. Ontario School Safety is soon to also publish a white paper with data we've gathered from several school boards across Ontario, showing the rates of absences in staff and students since the start of the pandemic and comparing it to prior to. There's lots of information now out there with the data. It's not going to go well. Now, this is as is, but I'm also an eternal optimist. And I also know, as we've discussed, there is low-hanging fruit. There are ways to make differences. They may feel small to you, but anytime we even just mask out in public, you are absolutely cutting transmission. And I never want to negate that if that's the only thing you do, you are doing a great amount of good over the time that you're doing that. So if that's all you've got in you, that's awesome. Like, good for you. And then if you have any spoons at all to do more, awesome. If you don't, then it's up to those of us who can maybe find that energy and time to do it for those who can't, and for those who are coming who shouldn't have to, and especially for our kids and those who educate them.
Yeah, like you say, it's the kids are just trying to do the right thing and go to school, and I think it's our job to protect them and make them safe when they go to school. I had I had to go for blood tests last week, and I was in the lab, and I was the only person wearing a mask. And this little boy came in. He was probably about 4 or 5 years old. Came in with his mom, and they sat beside me, and he just casually noticed that I had my mask on, and he immediately walked over to the free mask area and grabbed a mask for himself and for his mom, and
Aw.
came back and said, "Here, Mom." And she said, "Oh, I don't want that." And he went,
Oh, I was hoping that wasn't the result. I was hoping it was like, thank you, son, for educating me.
No, she said, "I don't need that. I don't want that." And he went, oh, he kind of shrugged, and he just, without question, put his own mask on.
Aw, what a
So
sweet.
I do, talking about the ripple effect, I do
Mm,
see, when my husband and I go out wearing masks, we get a lot of strange looks, but we
mhm.
also, when we see other people wearing masks, it makes us feel more comfortable,
It
right?
does.
And you don't know what ripple effect you're having with someone else going, "Oh, I can put on a mask now too," right?
Yeah. And there is that understanding that, we are real followers.
Mm-hmm.
When more people do it, more people will do it.
Absolutely.
It's sadly, I mean, masking is a tough one because of all the vitriol that has gone on with it, right? And even leaders really saying, oh, and all this opposition papers that are just so flawed, but still getting all the platforming and all that. Sometimes you think, I feel like the masking fight is over. Like there's no way we can go back to that. But I don't, I do believe that that's a tough one to keep fighting, but
Mm-hmm.
I still think it's worth it wherever you
Yeah.
can, because like if this little boy saw you and did it, maybe just that appointment alone, he was a pretty little more protected, right?
Yeah.
If you can reduce the number of times any kids get it or delay it as much as you can, that's always a good thing. And like you said, the more who do it and the more who walk around and show it's okay and I can still participate in life because I've got this, then yeah, I hear a lot of anecdotal things too, like stories where people say, I was out with masks, someone's like, oh yeah, I should be wearing one of those. And now they don't go put one on, but they are almost there, like, and and then I hear people go, well, so I go, here you go, I have an extra one, and it's all
Yeah.
sealed up, and sometimes they'll take it. And yes, awesome. It's tough, but it's there, and it is again one of those small things we can do that if you feel the ability in that moment to do it, then it's awesome.
Yeah, and there is a movement. I mean, across the United States, I follow a lot of people on Instagram, and there are people out there still masking, and they don't want to feel alone in
Mm.
that. So, yeah,
And the mask blocks, they have a lot of those down there, right?
yes,
Which is great.
yes. So, why hasn't clean air become standard in all schools, even after a global airborne pandemic? What's stopping more schools from implementing clean air strategies? Is it money? Is it awareness? Is it misinformation, politics, or something else?
Yes,
Yes to all of it.
all of the above. And I think that's what it is. When I was saying how I felt like this is a different time than, I mean, I'm sure I know, through at the start with HIV, I know there were similar, issues with what was truth, science, what was fact, what would help, how you convince communities to use the tools and whether they would ongoingly use them. And we know even with smoking, it took a long time, as much as, for us, we remember it working and yay, we don't smoke indoors anymore, in public spaces, but that also had a massive amount of pushback. So, perhaps just that I wasn't in those fights, but I think it's again, because this is such a global thing at a time when, many of our areas, public health that we've learned are sometimes really influenced by the government in charge that shouldn't be. So maybe they're not as at arm's length as we'd like them to be. Left so many gaps that's where disinformation goes, yes, and in I come, right? It jumps in there and fills those gaps. So now you're filling gaps with the mis or disinformation to people who are desperate for some and people who are getting it from names they normally thought, have served them well in the past. But we've seen even some of those people who we may have thought were respectable, wise people go down the rabbit hole. But they're still getting these platforms because they've always been the go-to person, right?
Mm-hmm.
So I think between social media information spread, which can be wonderful, and it's honestly how I've survived so far and how I've connected with amazing people like you or with my co-host, of Resistors, Christine, how we've done all these, like, I can't imagine. I certainly wouldn't have had the knowledge I have now if I hadn't been able to connect online,
Mm-hmm.
because we went through something that required us to not be in person with people. So it's been wonderful. But again, because I think it's the clash of so many things that are happening at the same time, that when that disinformation takes hold, it is so hard to pull it back,
Yeah.
especially when the disinformation aligns with people's need to just get on with how they were living before.
And not change their behavior in any way.
Right.
Yeah.
Because remember, at first, everybody was sorted together, right? But doing that forever, ooh, that's a tougher thing for me to be okay with, right? I was fine when we thought it'd be over in 4 months or 2 weeks or even 8 months. But, if you're saying this is forever, I might have to wear a mask, or forever that I, may have to start thinking about disabled people or health, whatever, that's much harder for people.
Mm-hmm.
And because, I think one of our things early on, Ontario School Safety, and so many of these organizations that have now gotten together and are looking to make change with, our leaders, the ones who can actually implement policy and enforce it, where things like you need to, have a group together when you're dealing with these things that is intersectional. So you've got engineers and you've got, air quality experts and even architects, because we know the type of buildings that get built now, once they learned they could earthquake proof one, are different than prior to that. And just like with this kind of crazy thing we've just gone through and continue to go through, that's impacted by the air we breathe, I can't believe that the same changes to buildings hasn't been implemented yet,
Mm-hmm.
because it's normal for architecture to follow along those things, right? So architects, and then change management specialists, social psychologists, science communicators, there's educators themselves, healthcare workers, all the stakeholders, which is virtually someone from almost every field you can imagine, involved, and or at least the ones with the knowledge that would help guide policy, be the ones that they go to. And that still continues to be, a push for us, something that we hope will happen. Sadly, where we are, we have a certain government that is in for a few more years and doesn't appear interested involving. I mean, we've tried for years now, and there's no engagement, and there's actually, of course, further cuts to public education, public health care, all that. So wherever we live, it's something different. Depends who's leading you and who will listen. But I just think that it's all of those things combined that has made it tougher. I do think we are getting somewhere, but like someone wisely tells me whenever I'm like getting frustrated is, and it's the last thing we want to hear, especially those I would imagine suffering chronic illness, is that this is a marathon and not a
Mm-hmm.
sprint. But it probably already feels like 8 marathons for many people. Um, and even for me, who doesn't have chronic illness, but who is perpetually emotionally drained by all the extra stuff you have to do just to try to keep your loved ones and yourself safe when no one else around you seems to think there's something to keep safe from, and no leaders that normally would do it for you are doing it, you know. But there are things happening, as desolate
Good.
as it might sound.
Good.
I know, it's so hard.
So, how can we make the case to decision makers that clean air is not just a COVID measure, but it's a long term investment?
I think we probably would follow the same sort of idea of anytime you can engage with perhaps a local politician. If at election times, or if there are engagements where they'll attend, I've taken advantage of those times. If we have a street sale, we have it every year in my town, and there are people put their booths along, and often local politicians, MP or MPP, will be there. I walk up, I've got my mask on because it's usually crowded out there. I introduce myself, I say what Organized Ontario School Safe with and what we're interested in doing, and then get their card, and then try to have a conversation, whether it's online or whatever, and just start picking away. But again, not it's coming in from COVID, because I need to gauge where they're at with that before I have that as my lean in.
Mm-hmm.
More like trusting that those of us who are fighting for it have the upper hand, and that if we convince them to improve the quality of air for all the other reasons, and it stops us from getting COVID in the meantime, well, we got you anyway, right? We got what we wanted anyway, sort of thing. Do I need to be right and make sure that COVID's hammered home? I'd like to be. It feels better. But if we're looking to get something done, we kind of have to do that game, which is, find out what they're willing to listen to and what matters most to them, and how it maybe aligns if they're an environmentalist, or right, because the more things outside, the quality of air outside impacts the quality of our air inside. So you maybe reach that way, or perhaps they have an affinity for like the Parkinson's organization, or a loved one maybe has had an illness that might have been helped by this, whatever it is. If you can find ways in, I think the way we do this is by coming at it from all angles. So whatever route you feel you can make an impact, just do your best, because someone else will work on the federal government people, someone else working on your provincial or territorial or state, someone else will work on their grandmother who won't wear one, someone else, like we said, is just going to wear a mask when they live their lives because that's all they can commit to. I think it's just from chipping away over time at all the places, making the conversation around clean air a normal thing, helping to shift the paradigm to clean air is a reasonable thing to expect. It's not an absurd idea. It's been around forever. Obviously, you must see all the sickness around, and look at this can help you with this. Your productivity increases. Show them all the data and how it impacts the bottom line, the money. And then if you have the energy, hold them accountable with legal paths. I think there are going to be a lot more of legal suits as time goes on, when they can't deny the negligence that's occurred over the last few years.
And I think it just makes sense in terms of cost effectiveness, because sick days and medical leaves
Yeah.
are not cheap for school districts as
No.
well as the government, right? There's a huge backlog in disability cases. Um, Teachers and healthcare workers are both at the top of that list.
Yeah.
I have multiple teacher friends that are now on disability.
Mhm.
So, they may look at it in the short term as being, too expensive for school districts and for the government, but long term, I think they really need to look at this.
Yeah, absolutely they do. And I think once the data gets to be so in their face, it won't matter. I think a lot of us think like, well, someday people will realize what COVID's done to them. And I kind of think I'm not sure that we're going to have that day. Not that I want people to get long COVID or suffer issues from COVID, but I don't think we're going to have a day of reckoning like that because it's so hard to identify. People don't even know that they've had COVID. It's with the asymptomatic, no testing, all that. So I think they're going to just be really sick a lot, or someone they love is like, inexplicably sick all the time or has some major health issues out of the blue when they were normally a low risk person. I think it'll be more about just, yeah, well, air quality can help with that. And whether they ever say, yes, it was because of COVID, I don't think we're going to get that as much as it would feel great to have a realization because so many of us have been told we're not well in the head, right?
Hmm.
Because of what you say you're feeling or what you're fighting for. So I think I've also resigned myself to the fact that I'm not going to see it come up in this moment or, that realization. I think it's just going to be, we're going to see, and hopefully leaders will see the amount of chronic illness, the amount of increase in cancer rates, heart attacks, strokes, learning loss, all impacting economy and what they're going to have to pay for and all the things that will make the change that we really want for a variety of reasons, but COVID too, especially or whatever. It just won't come in the way of feeling really great. I don't think we'll get
Yeah.
you guys were right all along,
No, no, that's not
we
going to
will know
happen.
and we'll finally, like, yes, right. But
Yeah, I think we're
yeah.
too far removed at this point, and
Hmm.
there's been a rewriting of history. And did COVID even really happen? And we're not testing anymore. And but yeah, I keep getting sick. Like,
You're like, oh, I
yeah,
know. It's a big connect the dots sort of
yeah,
thing, right, that we're missing.
absolutely.
Yeah. Yeah. So my co-host partner of our audio spaces, a couple of years ago, we hosted a space and we had a psychologist join us because we thought we just need a space where people can share the struggles they're having with all the relationships in their lives because of how most of us are informed, but then so many people were just living their lives, didn't think it was a thing. What it was like between you and maybe your workplace, what it was like with you and a partner living at home if you're on different pages, what it was like co-parenting when your one partner, your ex, doesn't feel the same way and your child's with them, a week out of every 2 weeks, how do you deal with those things? All the different, what if someone in your house infects you? How do you feel about that? How do you go forward? So we had people share their questions and stories for him, and he was really kind at, he wasn't fluffing anything or trying to solve anything, but just sort of providing some thoughts. And the one thing that he said was really healthy. He said, and I've used it a lot. He said, when you feel like I know still even now, I might be out in public doing something and I look around, I'm like, there's so many people who just look like they're fine. And they're out and they're doing things like, have I just held my children back from so much? Have I whatever, worn a mask wherever, and I didn't have to be the only one. If I blah, 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 right? And he says, but sometimes it's important that you find those groups that help you do a reality test once in a while. And we found that space, plus every time we checked in and hosted a space, and we saw the people who we are like-minded with and who were providing the information, the research, the data, the expertise, and all that, we would get a reality check, a reality test saying, you're not imagining this. You are on the right side of history. It just doesn't feel like it sometimes. Um, and so I just think that if we can, in those moments where you're doubting yourself, if there's any of those anymore, or sometimes, just go to whoever it is that normally keeps you in check and goes, no, you're not losing it. Like you're right. In fact, the data is just increasing to support your perspective on things now. COVID itself is the most studied infectious disease on the planet with up almost 500,000 papers on it. It's absurd, right? So I would just share that because I found that really helpful to me in moments where I'm doubting if I'm right to have been doing this for so long, or if I'm just, off base or whatever.
What's your vision for the future of healthy school environments?
I think probably my biggest vision, I guess, mostly because I'm impacted so directly by how abhorrent our provincial government has been here when it comes to education. It just happened to be we had them at the time of the pandemic. I'm like, great, there's a recipe for disaster right there. Is to finally have someone leading who actually respects public education and who simultaneously, because I've learned how important now science is to lots of things that I wouldn't have clued into before, but who is not afraid of science, has some either knowledge or at least surrounds themselves with people who are aware of current things and open to learning, that we learn things all the time, so that when their mandates and when their slogans and all these things come around about providing safe and inclusive spaces for the best learning for our kids and the best work environment for the education staff, that they include for sure what we know now about air quality as a part of that. And then whatever it is down the road is new that we learn from whatever, that they make funding it a priority because of its impacts to everything else. And I think it will require, leaders who, like you said, can see down the road and not just what will look good on them now.
And how could this movement for cleaner in schools expand to other public spaces? It would be nice to feel
Mhm.
safer going to the movies and to restaurants.
Yes. Well, okay, a couple of things I would say, and I'll try to be brief with this one. When we started out as Ontario School Safety, and we were trying to, write letters to the government, or had like a letter that people could sign on to, and requesting, funding and information and just conversations around it. How can we help you, learn what to do for schools, blah, blah, blah. One of the things we did was we included a letter that community members could write, even if they didn't have children or any family members in schools, because we knew the impact community of illness being transmitted and shared in schools. We knew what that impact was, and that whether you're connected to a school or not, you're probably being impacted. You might not realize it. Your spaces are less healthy because of all that's allowed to go on in these sick buildings. And I want to mention on school buses, we can't forget the role that school buses plays in disease transmission. We talk about it a lot, but it's harder to get people to, for sure, to fund better busing and all that, though we're trying. So, we try to get like all the members kind of the community involved, like understanding the impact. So I think if we can make these changes in schools, then there will be less shared out into the community automatically of illness, out to the arts council clubs and teams and chess clubs and whatever it is people are involved in, as well as understanding all the ways schools are used. They're used for adult education in the evenings. They're used for polling stations during elections. They're used for, board-wide sports tournaments of things, right? So the number of elderly people often volunteer in them. There's people who deliver food for the lunch programs, volunteer speakers, like all of those people who come in go out. So it's not just the kids that are heading out and sharing it. It's anybody who enters a school structure or school bus can make that impact. So I think if we can, make improvements in those two areas, knowing what an impact they have to transmission elsewhere, I'm hoping that will, with data, because we'll have to show it in numbers and the improvement in costs and reduction in illness, all the things, that people will see, oh my gosh, this is like one of the best examples we could use. We need this in long-term care for our seniors. We need this. Look how easy it is now. Look what they've done. We can do a bit of that and really get people to start doing what they can in their homes. I actually think if people knew a bit more, had their monitors, just like we have CO monitors mandated in our homes for something that's invisible, odorless, colorless, but can do great harm in high numbers. If we had the CO2 monitor doing the same, it just becomes part of our day-to-day life. We look at the numbers, we see the thing going red, we open the window, or we turn on this, or whatever. So I think if we could do it in schools, the impact would be great. And I think it would be easier to convince places to do it. We're grateful that the Canadian Standards Association has put out policy recommendation recently to mandate masks in all healthcare settings, visitors, patients, staff. That includes dentist offices, physiotherapists, places. There's opposition to it by the obvious minimizers, but it's an incredible standard. So if we could get schools and healthcare, because that's the second place that most transmission comes out of, the amount of illness we would prevent and the amount of people we help thrive rather than just survive would be incredibly high.
Mm-hmm. Well, thank you so much for joining me today. And I hope that parents, teachers, and administrators found our discussion thought-provoking and will apply some of what they have learned today towards making our schools safer for everyone. Thank you.
Thank you, Noelle. It's a real honor speaking with you. Thanks so much for your time.
Thank you for joining us for another episode of Voices of Long COVID. I hope you found it informative. Please make sure to leave us a review. You can follow Voices of Long COVID on Instagram, TikTok, X, Blue Sky, and YouTube. You will find new episodes as my energy allows, wherever you listen to podcasts. Until then, stay safe and stay informed.